Let's talk about this 2 metre distance. The World Health Organization has advised a 1 metre distance to maintain for social distancing, and say that washing down surfaces, people washing their hands, and face masks, like these are the things that are really crucial in terms of keeping people safe on transport. And yet you want to impose a 2 metre distance, meaning that we'll have something like 10% of the normal level of passengers on public transport. How on earth are we going to get the nation back to work when you're imposing a 2 metre distance?
Yeah, well, the first thing to say is if you can work from home, do work from home, because we're not encouraging everyone to go back, only those who absolutely can't do their jobs from home. And the second thing to say is a very unusual thing for a transport secretary to say, but please avoid public transport if you possibly can. So other means of transport, walking, cycling, of both of which I've just put a lot of money into and announced a £2 billion package, of which 250 million is being spent for now quickly in this emergency, to try to encourage people to go other ways, and other things coming along as well, like e-scooter trials being brought forward to next month from next year and all that sort of thing. But it is the case, as you say, that the further apart you are, the better it is, and that's what our medical advisors, our chief medical officer and chief scientists tell us. So we're advising people the ideal is to maintain the 2 metres, but there will be times clearly where you pass somebody in transport and you may not be at that distance. We're advising people to wear a face covering, not a mask, a face covering that you make at home, and there are clear instructions about how to do that on the gov.uk website, and a number of other things that you can see in the guidance, which is also downloadable from there. Example, it's better if you're side by side, not face to face or back to back. Those things are better than being face to face. So there are various different things that people can do.
You're offering advice, like, say, wear a face covering, and we understand people we shouldn't be going to use medical grade face masks, and people understand that. But why not, at this point, make masks compulsory on public transport? They may not actually make much of a difference. The evidence is a little bit unclear on that, but they may make a difference at the margins. What's the cost of people having to wear a face mask?
Yeah, no, you've nailed it right there, actually, which is that the difference is a marginal one. But nonetheless, I think both in terms of reassurance, and not really so much for the person wearing it, but for that person not passing on coronavirus.
So why not make? But why not then, even if it's at the margins, why not make it compulsory?
Well, one of the things we don't want to do is take away. There's been a lot of talk, of course, over the weeks about making sure that we have protective equipment or PPE kit available for where it's required. We don't want to send people off in the wrong direction and take that away from where it's actually needed in medical circumstances, which is what Public Health England and everyone else advised to be the case. So it's an assistance, but there are other things that you can do which are far more useful. That's what I should say. Wash your hands. Stay at home first of all. If you absolutely have to, can't do your job from home, then we are saying you can start to go out to work if you're in one of a number of different industries like manufacturing and construction, but not everything. We're not asking people to go and work in some of those closed businesses still. But there are many other things which are more helpful. Wash your hands before you go in. When you come out of the underground, carry hand sanitizer. If you do come within 2 metres, try to not be facing that person, and much else which is all available in the guidance, which you can download right now.
Why not ensure that all transport workers have PPE, have personal protective equipment? We know that now at the front page of some of the papers, rail ticket clerk Belly Mujinga, she had some respiratory problems. She's 47 years old. She died after being spat at by a passenger. It was the day before lockdown. No one was really wearing masks. Said she certainly wasn't. Again, a lot of transport workers very concerned that and we know, of course, bus drivers and people working on transport networks have been at very high risk of dying of coronavirus. Why not give it PPE for transport workers who are on the front line as well?
First of all, that Belly Mujinga case is absolutely heartbreaking. My heart goes out to the family and friends. But that was a case of somebody breaking the law and spitting at somebody, as far as we're aware, and the British Transport Police are investigating. Of course, we've got to follow scientific advice, and Public Health England are saying, look, if you're a train driver and you're in a cab and you're on your own, there really isn't a reason to wear PPE. But transport workers are in lots of different conditions, as you say, depending on whether they're driving a bus or a ticket office or all the many other places they could be. So again, I've issued further guidance to the transport operators themselves this week, earlier in the week, to ask them to look at their own individual workers, their own individual circumstances, and to follow the guidance carefully. And we've got sort of checkups on that through the Health and Safety Executive as well.
But look, we know the thing is that lots of people are focusing on public transport. The vast majority of people in this country don't use public transport to get to or from work. They use their cars. I've seen places like London where the congestion charge has been stopped for the duration. But what about parking charges? Far more people would drive to work wherever they work around the country if they knew they could park more cheaply. They could get to work more safely. Is it time to cut those parking charges so that people can actually get to work in the safest possible manner?
So a lot of councils have taken that action already. This does vary around the country, and this is something which is a matter for the local authorities, and we've asked them to look at the situation and circumstances locally. There may be places that, for reasons of sort of managing the traffic, you do need to charge, and other places where it's best not to, and allow people to drive to work or get close and then walk the last part. So I see a lot of different schemes coming together around the country where excess car parking spaces, or perhaps shopping centres which are still closed, are being used for all-day parking. So there are many different options there. It's not a sort of blanket, they should all do this, but we're working very closely with local authorities to find the right schemes in their areas.
Okay, and in terms of travelling rather further afield, when it comes to quarantining people coming in and out of the country, why would we allow people to come in and out of France without quarantine, or Ireland, but not any other country? What's the purpose of that?
Well, I think Ireland is the exception. We've had a common travel area with Ireland, way back even before the EU, and so travel has always been open between the two. It's always been treated that way, and should continue to be in the same way as we're able to travel between the different nations of the United Kingdom. Although we do stress that there are slightly different rules in place in Scotland, Wales, and Northern Ireland, including the stay-at-home message for people listening there. But the rest of it will be published in the days ahead. This isn't an instant thing, but we do think it's right, broadly speaking, that if we're asking Brits to stay at home where possible and work at home where possible, which remains the case, stay alert if you are leaving home, that we shouldn't then, as we get these numbers right down, be reimporting cases from elsewhere.
Okay, but am I not right in thinking that when the Home Office was calling for tighter controls on people arriving at British airports and ports, you were one of those arguing against that and against people being compulsory tested when they arrived and then quarantined? Why now do you want to have those controls? Many would say is shutting the door after the barn door after the horse has bolted.
No, I mean, I just go with the medical advice. I asked the Chief Medical Officer right at the outset, should we close the borders? His answer was no, that won't stop it at this stage. It's already here. That won't stop it at this stage. And apart from anything else, there was something like 3 million Brits who had to be British nationals who needed to come home. So it wouldn't have. Most of the people actually travelling here have been British citizens to come home and then stay at home as the rest of us have done. So that wouldn't have actually worked. The difference now is, of course, as we get that R number down and the number of cases down, what we don't want to be doing is reimporting cases. And, of course, at this end of at this point in time, we've got the testing capacity and much more knowledge about the virus, meaning that we can do the test, track and trace thing, which will make it actually work, whereas it would have been ineffective at the start.
Okay. Can we also talk about some of the, again, it's not actually confusion, it's just people don't really understand what the logic is behind some of the new government rules. I can right now, it is legal for me to go and sit 2 metres away from strangers on a bus or in the workplace or in a park, but I can't sit 2 metres away from my mum in her garden. I can also go to someone else's house, a complete stranger, walk around it with a view to buying it, but again, I can't go and sit in my mum's house. A lot of people are wondering what on earth is the basis behind these rules. Can you explain it? I'm hoping there's some sense behind it.
There is. So I think in the first place, of course, locking down is quite straightforward. The message is the same. Everyone had to stay at home. Simples. The difficulty is, as soon as you start to unlock that, of course, you're going to get well, why can I do X but I can't do Y situation? I think I've talked to you about them before. My parents, who I haven't now seen for months, who are in their 80s, and I'm desperate to see them. But there has to be a cut-off line somewhere. If you go and visit somebody's house, but if you go and look at somebody's house because you're moving home, or move home indeed, it's a one-off activity. Of course, if I see my mum, it won't be a one-off activity. I'll be going backwards and forwards. It's also very difficult to maintain social distancing in a case like that, because it's your family. There has to be a line somewhere, and particularly with more elderly people, we're very, very concerned that they remain protected. So the same rules apply to, for example, people with underlying health conditions, people over 70 and the like, that we've said all along, which is incredible caution needs to be applied, because we know that this virus hurts certain people more than others.
Just finally, I know you have to go, but we talk about protecting elderly people, and we want to do that with our elderly parents and grandparents. But we now know so many deaths are now happening in care homes. 40% of deaths in England and Wales in the final week of April were in care homes. Now, a lot of that's down to the fact there are fewer deaths elsewhere. However, a lot of this came down to the fact that we imported coronavirus into our care homes by elderly people being discharged from hospitals to care homes, some actually testing positive for COVID, and some not being, or most not being tested at all. Looking back, things were done at the time to save the NHS. Everyone understands that. We're not going to do things perfectly. No one's expecting the government not to make mistakes. Looking back, we don't have to be experts to think that that was genuinely the wrong policy, was it not?
Well, some medical decisions will have been made at a time based on the knowledge that was available at that time. And as I constantly think about this, then say, if we had all the knowledge at the beginning that we have now, if we ordered the testing capacity that we had now, if we understood this virus so much better, then of course we may have looked at the whole picture differently. But it is the reality that, and these weren't government decisions, medical decisions will have been made all along based on what was known at that moment in time. It's probably worth mentioning, I mean, you already said it actually, that although the proportion of deaths in care homes looks higher, that's actually because the number of people dying in hospital has been coming down, and the number of deaths in care homes has also been coming down, and the majority of care homes do not have coronavirus still in this country as well. But every death has been an absolute tragedy, and hearts go out to everybody involved. I know quite a number of people, unfortunately, who haven't made it through this crisis, and I will be in common with all of your listeners.
Okay, just finally, can I sneak in a final question before we go to the break, if you're not racing to another interview, Mr. Shapps? Have you got time?
Yes.
Just want to ask you about the furlough scheme. Again, there's so many different topics I want to ask you about, but I was trying to focus on your area of responsibility, transport. But on the furlough scheme, we've now got a quarter of the entire workforce, 7.5 million people furloughed, £14 billion cost a month. Could be, Institute of Fiscal Studies says, £80 billion total cost. How can we afford that?
Yes, it is an expensive scheme. I think probably the question is, how can we afford not to do it? And the ONS, the Office of National Statistics, say this will save the economy money in the longer run, because otherwise we'd end up with a situation where we were paying the unemployment, where it's much harder to get those businesses up and running again, where the economy would grow slower coming out of this than we hope it will as we bounce back from this. So I think it's very important that we've done this. The figure I actually have is 10.1 billion in cost so far. I think it's really, really important that we do look after people, both save lives and save livelihoods, if you like, and as people start to move around now, stay alert as well.